Good evening. Thank you for joining us. My name is Doug Prishpreet. In recent news, we've seen a resurgence of the measles across America. To many Americans, the measles is just the next scary disease to follow in the footsteps of Ebola, West Nile, mad cow disease. The list goes on and on. But what the important thing to take away from this is what the individual can do about measles and what you can do for your family on the subject of measles. Tonight's segment, we will be looking into what the measles are, how it can be prevented, how to recognize it, and what treatment options are available. This evening, we have a multi-part presentation for you. The first part, we're going to be visiting a very, very motivated teacher by the name of Mrs. Frizzle as she discusses the subject with her class. Then, we'll see how a patient who currently has the measles goes to a doctor and what treatments are rendered. Then, our own news correspondent, Martin Brungus, will sum up all that you need to know to keep yourself and your family safe. Thank you for tuning in.
Hello.
Hi.
How are you? What's your name?
Good. I'm Tana.
Tana. Okay, Tana, what seems to be the problem?
My face has been breaking out and all these red spots just appeared.
I can see that. Can I see a closer look about that? Yeah, that does not look good. Now, is there any swelling going on in those places or itching that you're concerned about?
Yes, everything itches.
Now, do you have any other symptoms along with the rash that's going on?
I have a fever that won't break. I've been coughing a lot. I have a runny nose and my eyes are burning constantly.
Well, that's... oh, man, I'm so sorry to hear that. Now, what's the highest your fever's gotten so far?
It was 105 last night.
And will the fever break?
No.
Okay, well, what I'm going to do is I'm going to go and take your temperature again, if you're okay with that.
Yes.
So we can see where we're at. All right, let's take a look. 102.8. Okay, so that is really not good. That means your fever still has not broken. So I think what I'm going to have to say is, after looking at your symptoms, I think you have measles. I know. So let's go ahead and take a closer look at that.
Any questions, students?
Mrs. Frizzle,
Yes.
what are the expected symptoms of measles?
Well, students, the measles occurs in various stages over 2 to 3 weeks. The first stage is the infectious phase and incubation phase. This occurs during the first 10 to 15 days in which you are affected. At this stage, there are no signs or symptoms present. In the second phase, non-specific symptoms begin to show. This includes mild to moderate fever accompanied by persistent cough, a runny nose, inflamed eyes, called conjunctivitis, and a sore throat. This mild illness phase may last 2 or 3 days. Yes, Savannah?
Ms. Frizzle, when will the signs specific to the measles appear?
During the last phase, and this is when during this phase of measles, a rash appears, consisting of small, slightly raised red spots. Spots and bumps may form in tight clusters, giving the skin a splotchy red appearance. The face will begin to break out first, and over the next few days, a rash will spread throughout the body.
How long is a person with measles contagious?
Well, a person with measles can spread the virus to others for about 8 days, starting 4 days before the rash appears and ending when the rash has been present for 4 days.
Ms. Frizzle, the measles virus sounds so scary. What does it do to the immune system?
The measles virus essentially erases the immune system's memory, which weakens the body's immune defense. This effect is called immune amnesia. The immune system is composed of B cells and T cells. These cells are the body's defense system against diseases because they remember past infections the body has encountered. The measles virus destroys these cells, resulting in erasing their memory. New cells are formed, but they only recognize the measles virus, not the other infections they were exposed to before.
Is there anything we could do to stop it from happening to us?
Yes, we can. Thanks to scientists, we have available to us a vaccine that can help protect us from contracting measles.
How does this vaccine work?
Well, the vaccine administered is called the MMR vaccine, which works against 3 different diseases, measles, mumps, and rubella, all at the same time. It contains a weakened strain of these viruses that, when injected into our bodies, can induce an immune response and lead to immunity from the disease.
If the virus is dangerous, why would we intentionally put it in our bodies?
Good question. Once we inject this weakened strain, our immune cells recognize antigens on this foreign strand and prompt the immune system to attack. Macrophages in our bodies digest these microbes and take the antigens of the virus to T and B cells in our lymph nodes. T cells kill cells infected by the virus, while B cells create antibodies which bind to corresponding antigens and stop their function. Since the injected strand is weak, the virus is easily eliminated. However, we still have memory T and B cells corresponding to the measles virus, which can protect us in the case of future invasion by the virus.
Can everyone get the vaccine?
Some immunocompromised individuals are unable to receive the vaccine. Some people don't have the resources to get the vaccine, and others opt out of it for personal or religious reasons. In these cases, if the virus is contracted, there is no universal treatment, but some measures can still be taken, such as an immune serum globulin. This is an injection of antibodies to help the immune system respond to the virus and reduce the symptoms or prevent the disease altogether.
Wow, viruses are so complex.
They are indeed, but studying these viruses is what helps us prevent and treat them. And that, kids, is why microbiology is so important.
Hi, Miss Tina.
Hi.
How's it going? How are you feeling?
A lot better now.
That's so good. I'm glad to see that the vaccine worked.
Good evening, everyone. My name is Martin Brungus, and I'd like to welcome you back to our broadcast. Some of you may feel unsettled after learning how dangerous the measles virus can be, but rest assured that it only takes a few easy steps to protect you and your family. The single most important thing you can do is to ensure that you have received the MMR vaccine. It is 97% effective at preventing measles after 2 doses, and it is very safe, having only mild side effects, which include pain, stiffness in the joints, fever, and a mild rash. The importance of vaccination should not be underestimated, as there is a 99% reduction in the number of measles cases in the United States per year since vaccination became widespread in 1963. Before their implementation, 34 million people suffered from the disease, and it caused 400 to 500 deaths. Sadly, there is no specific antiviral treatment for measles, so most treatment options are limited to the prevention of bacterial infections, maintaining hydration, and pain relief. If you suspect you have been exposed to the measles virus and you have not previously been vaccinated, you should immediately get post-exposure prophylaxis, or PEP, and or exclude yourself from public spaces. There are 2 types of PEP, the MMR vaccine, which can be administered within 72 hours of initial exposure, and immunoglobulin, which can be administered within 6 days of exposure. Additionally, due to measles' extreme virulence, those infected should be isolated for 4 days after appearance of a rash. That marks the conclusion of our program. We hope you have a better understanding of the measles virus and how to avoid it. Thank you for watching.